It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Lowcountry, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
No one likes to wait, especially in any ER waiting room. I mean, when I'm sick or my family has a medical issue, I don't feel like waiting around with a lot of other people. Not to mention they're sick too. Honey. And my family does not wait patiently. You can imagine how uncomfortable and how long it can seem. But then I found out it doesn't have to be that way. I can check in online and wait anywhere I want. What's not to love?
It's the smarter way to ER at Hilton Head Hospital.
We are here with Dr. Kirk Johnson, orthopedic surgeon. I'm very thrilled to talk to you today. We love having him captive in your own space. It's amazing. We thought it might be interesting, a lot of fun today, to talk about kind of the broad spectrum field of orthopedic surgery and what specifically you're doing here at Hilton Head Hospital. Because as we talked a little bit before we started, you said I'm really proud of where we're going with this service. Love to have you share a little bit about that.
Sure. Well, 6 years ago, the administration of Hilton Head Hospital made the decision to improve the orthopedic program.
Okay.
And in fact, improve the surgical program in general, but specifically in orthopedic spine and joint replacement. At that time, only 20% of the residents of this area stayed here to have their joint replacements, to have their spine work. Small slice of the population. In spite of the fact that Hilton Head residents don't want to go over that bridge to go to Savannah, to go to Beaufort, they did.
Okay.
We now can happily say that 70 to 75% of those same people are now staying here on the island to have their joint replacements, to have their shoulder replacements, knee replacements, hip replacements, and spine surgery. So it's been 5 years is a fairly short period of time to have development, to have a confidence change in the community and 50%. To develop a program that really works. So that's happily where we are now.
How and why has it shifted? I know you've got extremely credentialed surgeons here. Talk to me a little bit about the program with the people.
Yeah, it's a combination of getting the right people, getting the right commitment from the hospital, dollars.
Got it.
Infrastructure, improvement of what we have to use to do our job correctly, and to partner with other businesses in the area, the home care companies that deliver care after patients leave,
sure,
and with industry, the people that bring us our implants.
Let me ask you a quick question, and I think many people want to know the answer to this, and that is, what are the questions that I need to ask you when I'm considering have a joint replacement? I've got a bad shoulder, I've got a bad hip, I've got a bad knee, I've got input from a lot of lay people telling me what I should and shouldn't be doing. I've always felt like I come to the physician and I say, help me make that decision. What are some questions I should ask?
Well, you really want to ask, how experienced are you?
Okay.
Now, I'm an older guy, obviously, so people kind of right away know that I've been around a little bit.
That's right. We call that wise and seasoned.
Exactly, seasoned. So, yeah, you want to ask your surgeon about his experience. A lot of folks will research docs in terms of their credentials, where were they trained, and so forth. But really, it's the institution that carries the results. So you can take a very experienced surgeon who's done thousands of joint replacements, go to a low-volume hospital, and get not so good results in spite of the very well-credentialed doc.
Got it.
So it has to be a well-trained, well-credentialed doc, a team, and a high-volume center to get the best results. You want to ask, what are your results? What are your complications? I read about infection. I read about dislocation. I read about blood clots. What are your numbers?
Okay.
And that's a fair question, very fair question. And I should know the most up-to-date answer. And it's public data, so it's not like I can be dishonest. I have to be very honest because you can find it if you want online.
Are joint replacements simply a function of as we age, mature, get older and wiser, that our joints just wear out? Or is it, and I've always wondered in this area, especially because we're pretty active, is it just that we work our joints a little bit harder than we used to?
No, that's the common question. It's just because I'm getting old, right?
Right, I'm getting old.
And the answer is it's not about age. Now, is it more common in the 60, 70, 80-year-olds than the 20, 30, 40s? Of course.
Okay.
But it's genetics.
Oh, it is?
It's genetics. So I have people in their 50s that need both hips and both knees replaced in their 50s.
Wow.
Normal activity, not marathon runners, just everyday people. And they say, yeah, my brother just had his hips and my dad had his hips and one knee. And so genetics is number one. You can push genetics positively or negatively if the genetics are there.
Lifestyle.
If you practice poor, smoking, obesity, but it turns out activity is not a factor. So the fact that you ran marathons between your 20s and 30s does not put you at risk. Common misconception.
Oh, is it
In fact,
really?
the treatment for early stages of osteoarthritis is exercise. That's the cornerstone of how you treat a knee that's beginning to show signs of osteoarthritis or a hip, is exercise, aerobic exercise.
Got it.
It can be stationary bike, swimming, biking, whatever. Will nourish the cartilage in a positive way and keep the joint going. So if I take Joe number 1 sitting on a couch watching television, not active, and Joe number 2 who does something every day, gets on a bike, gets in the pool, and they have the same level of disease,
Got it.
I can tell you that the second guy is going to do well for a longer period of time.
When I come into you as an orthopedic surgeon, my shoulder hurts or my knee hurts or my hip hurts, is surgery what I'm looking for? How does that, what are the treatment protocols from your point of view?
I can't think of anybody that wants to have an operation.
Right, I have a sore shoulder, do I need surgery?
So surgery is the last step.
Okay.
So you want to give me a history when you come in with your sore joint, tell me how it bothers you, what you've done so far, and I'm going to more than likely 99% of the time tell you that there are things that we can do prior to any surgery. Now there are folks that come in very well educated, they've gone online, they've whatever, and they're ready to go. And if in fact the criteria are met, then we go ahead and set them up and get them going. But there's a lot that can be done non-surgically in the form of exercise, in the form of medications, in the form of therapy, a lot of things that we want people to do. Even if I know in the back of my mind this lady's going to need a new hip or knee.
Exactly.
Yeah.
Well, and you brought some really interesting things that I thought we might want to go over, because I think when surgery is the option and is the correct protocol, you have the techniques and the technology here for cutting edge kinds of treatment.
Right.
Share with us a little bit.
Yeah, so this is just a model of a knee that's at the end of the road. That end of the femur, the thigh bone, should be covered with nice white smooth cartilage. This is obviously eroded, it's pitted, it's discolored, and that's an advanced arthritic knee.
Okay, that's just osteoarthritis, period.
Correct.
Got it.
Correct. So the only treatment for this, once it gets to this point, once the patient says I really can't continue to enjoy my life, is a knee replacement. And we've been doing knee replacements for 35 years, and this is a typical picture of a knee replacement where it's actually not a replacement as much as it is the resurfacing. So we're putting a new covering over the end of the femur, new cover over the tibia, and it's titanium and polyethylene.
How long do these last? And B, from a recovery standpoint, will I be back to my original ability to exercise, etc.?
Depends how hard you work. Yeah. So it has to be, are you going to do your job, particularly for that first month after it's done?
Are you going to be compliant?
Exactly. So it's a matter of continuing to be active. So this is kind of the typical look of a replacement. New technology now and is a uncemented. So the lower piece traditionally over 30 years has been cemented into the bone. This is an uncemented implant, very lightweight, almost weighs nothing.
Yeah.
And it has a roughened surface. So when I put this implant in, if you have healthy bone, now many women have osteoporosis, the bone may not accept an uncemented implant, but right now about 80 to 85% of the implants I put in are uncemented implants.
Okay.
Why is that important? Why is that a good thing? Cement's the weak link. If we can do something and not use cement, so what breaks down in your bathroom? It's not the tile, it's the grout.
No, it's my grout,
the grout.
exactly.
So same idea. If we can put this in without cement, in a healthy skeleton, then it's going to last longer. So the question of how long to, joints are certainly good if they're done properly, if people do their job, don't gain weight, 20 years.
Oh.
I think they're going to go 30 years, the newer implants. So for the balance of your life, assuming you don't live to 110.
When I come in to you for my knee, is it basically because I can't walk, I'm in pain, I feel weak? I've always wondered what the point is. Yeah.
It varies. It's usually night pain. So people say, it's bad enough now that I can't get a good night's sleep no matter what. I don't want to take a sleeping pill because I feel like I'm hungover in the morning.
Exactly.
I don't want to go there. That's one indicator. A profound change in the ability to live life, to do typical activities like getting in and out of a chair, getting up and down stairs, getting in and out of a car.
Yeah.
And then for some people, it's interesting when I have a spouse come in and the patient's talking about, and I say, sometimes it's a change in personality. Sometimes you, the owner of this sore knee, become a grumpy person. You become a grouch.
Yep.
And you don't realize you're a grouch, but you have chronic pain. You are always
irritable.
In some level of pain, so you become a different person.
Well, that makes sense.
Sure. So there are different reasons that trip the wire and say it's time for me to get this done.
We are really excited to have you today. We would hope, because now we love the environment that we're in, this is a lot of fun. Will you come back and share with us a little bit more? Today we specifically talked about the hospital and what you offer, and then we got into knees, but there are a lot of other things, shoulders, hips, things that
Plenty
I think
more to talk about.
Plenty more
I love
to talk
to chat.
About.
Anytime.
Me too. Thank you. Stay with us.
Thank you.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Lowcountry, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
The vision for Hilton Head Spine Center is very clear. It's to provide world-class spine care to our patients.
Physical therapists were there. They were there holding you up. It's nice.
I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here at Hilton Head Hospital.
Well, there's a lot of exciting things actually since I started here last year, June 20th, so I just celebrated my 1-year anniversary. I'm actually from Michigan, born there, lived there my whole life, and said, what do I want to do since I was 8? Come to the South, move to the beach, love it. So came here and it was kind of a whirlwind. We actually got our stroke and our chest pain certification within that first year, which is really outstanding for us. You're standing actually in our senior ER, which was a new project that I led with the ER staff. So I'm the stroke and chest pain coordinator and the interim ER nurse manager right now. So a lot of fun and exciting projects that have happened and continue to happen.
Tell me why the senior matters ER is so important.
So obviously our biggest demographic here in Hilton Head is the senior population. So we really wanted to make sure that we had a very specific set of skills with our nurses and our physicians to take care of those patients, going above and beyond the care that they usually receive. So they come here, it's a beautiful environment, it's very quiet as you can see. They're sectioned off from the other population. We do a very specialized assessment on them to say, you know, what are your needs, your activities of daily living, your pharmacological needs, your educational needs, and then your care and comfort while you're here. In addition to getting our stroke certification, we actually formed an agreement with MUSC in Charleston to provide 24/7 teleneurology coverage. So telemedicine is really the way of the future. So if you come in and you're having stroke type symptoms here at Hilton Head Hospital, you will have a world-class neurological stroke fellowship trained doctor at your bedside within about 10 minutes or less. So that means you're going to get immediate assessment at the bedside to see if you qualify for a clot-busting medication called TPA, or we can offer you other options. So you have that 24/7, 365 days a year, whether it's Christmas Day, New Year's Eve, all the time.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Low Country, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
The vision for Hilton Head Spine Center is very clear. It's to provide world-class spine care to our patients.
Physical therapists were there. They were there holding you up. It's nice.
I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here to Hilton Head Hospital.
Once again, we are here today on Healthy Living. We're with Dr. Shelley Ringer. We're really excited. We're changing things up a bit. We're trying to give you an opportunity to actually visit with the physicians where they work. We think it's really a powerful way to share information and allow you to see these doctors as people also. So Dr. Ringer, thank you for joining us. You've got some exciting things to talk about today that you're very proud of in the field of breast health.
Yes, so here at Hilton Head Hospital we have some really exciting new technology, and what it is a whole different way to do breast surgery. And the way we've been doing it for the past 30 or so years is if there's something that needs to be removed that we can't feel, a woman has to come in the morning of surgery and she has a wire placed that then tells me where this area is and how to get it out. And it's worked great for 30 years, but on some level I think we've always thought it's a little medieval. What are we doing? And there's this wire thing and it's kind of in people but sticking out, and it's the morning of surgery, which is
a little apprehensive.
Yeah, women are nervous, they haven't had anything to eat, it's not a fun thing. So there's been some technology around for a little bit to put something in the area that can be detected that is placed ahead of time.
Okay.
And the technology that's been out there for a little bit used radiation. And it worked again. However, anything that's radioactive makes us a little nervous.
Got it.
So a company recently came up with some technology to figure out how to remove something, this area in the breast, do it ahead of time, and so that they don't have this dumb wire thing. So this technology is called the Savvy Scout. And what happens is a woman comes in a number of days before her surgery. The radiologist places a little device. And,
yeah, this is pretty interesting.
Yeah, I don't know if we can zoom into this area. So it's a tiny little piece that no woman's going to feel at all, and it's placed a number of days before surgery.
So the radiologist just actually puts it inside wherever the lump is.
Exactly. So it's sitting inside. It's done similar to how the needle biopsy was done.
Got it.
And then this is inside the breast, and then during surgery, I use a handpiece that tells me exactly where this area is. So it pinpoints the area really, really well.
And we have a handpiece, so you can actually show people what, what the actual machinery looks like.
Right, so in the operating room I have this machine, and so we'll turn it on, and what happens is I use this, and this can tell me where exactly this thing is. And so when I get closer to it, It makes noise, and you can see here that there are numbers on it, and as I get closer the numbers go higher, so it allows me to really very specifically pinpoint the exact area that I need to remove.
Why is that so important, Dr. Ringer?
So if I'm taking something out, if it's, number one, if it's not a cancer, I don't want to take out a bunch of other tissue because that can really affect the cosmetic outcome, so what a woman looks like in the end. If it is a cancer, it really helps me pinpoint to know exactly where it is because I need to make sure I get enough tissue around it. And the more I know exactly where it is, the better job I can do to know how much tissue to take around it.
Better the outcome makes sense to me.
It actually is, and we have data that has looked at this sort of technology that shows us that it is much better outcomes by doing this equipment compared to the wire.
From beginning of having a mammogram or finding a lump to this, what's the typical timeline? I would think that, again, with women being apprehensive, it's kind of a scary thing.
It's an amazingly scary time period, and it can take, it varies, but sometimes up to a month or so. Part of it just depends on schedules. So a woman typically gets an initial screening mammogram.
Got it.
They would then get a call back to have what's called a diagnostic mammogram and then ultrasound if needed. So depending on a woman's schedule, that can take between 1 to 2 days to a couple weeks. They come back for those extra pictures. If something is seen that needs a biopsy, then a biopsy needs to be scheduled, which again can take anywhere from 2 days to a couple weeks.
Now, do you do that?
So I don't do the biopsies myself. The radiologists do the biopsy.
Okay, that makes sense.
A lot of times what happens is in between the time of a woman finding out they need a biopsy and having it, they meet me.
Right.
And I talk to them and kind of go through, okay, what do we really see? A little bit more detail than the radiologist has gone through with them. And then when the results come back, I go through that with them.
Are you pretty interdisciplinary here at the hospital?
Absolutely. So we have a whole interdisciplinary program. We have a breast tumor board, so anyone who has a new breast cancer diagnosis is presented and the information is reviewed. Everyone discusses to make sure that we all agree with the plan. People bring up different ideas of what they think might be going on, and it really is how all cancer treatment should be done. Just because, someone else may think of something that I didn't, and let's find that out sooner rather than later and have that discussion of what's the best way to take care of someone.
From what you and we had a chance to talk a little bit before, and you said this kind of technique, this kind of apparatus is really what separates us from a lot of different facilities.
Correct. So there is nowhere else in the area currently that has this technology. We are the first in the area to have this, and it's just such a better way to do it. And it's really the vision of Hilton Head Hospital and seeing that, staying on top of the technology and getting the newer technology and doing what's better for the patient. So there's a lot of credit to the hospital for doing that.
So after we have to know all the details here. So after you actually locate what you're looking for and remove it, you remove this with it.
Correct. So then that tissue goes back to the radiologist and they x-ray the tissue that I removed because it does make sure that indeed I got the right area. But the nice thing is I can tell right there in the operating room that I did because I have this and I check it. But it is still confirmed with that x-ray to make sure that the area was removed.
Is this, I know just enough to be dangerous, so I have a million questions, right? When I listen to this, how does it work?
So it uses light. So this device, when it interacts with the probe, it emits light, and that light is picked up by the handpiece. So that's how, and then somehow, I don't know the technology of this, then that light is changed into a sound that I can hear to tell what's going on.
And it's almost like a Geiger counter is what it sounds like to me.
It does, exactly. It sounds that way.
I'm here.
Exactly. It's very similar in that concept. Geiger counter is typically associated with radiation. And again, this is wonderful because it has no radiation. Whereas there are similar sorts of devices that do the same thing, but they have radiation. And even though it's an amazingly low dose of radiation, it is still radiation.
What is the typical hospital stay time? I guess it's different for everyone with procedures like this.
Wonderful question. So actually, so an outpatient surgery like this, they go home the same day.
Oh, this is an outpatient surgery.
This is outpatient surgery. And the other wonderful thing is by having this placed ahead of time, it lowers the amount of time they have to be in the hospital the day of surgery. Because before having the wire placed the same day,
2 procedures.
Exactly. So they'd have to come in, they'd have that procedure, they'd have the surgery. Now, this is done ahead of time. It's a lot quicker than the wire, so they only have to have the surgery. So it really cuts down the amount of time in the hospital the day of surgery by a couple hours at least. So it is typically for, you know, a lumpectomy, in general, they might total be in the hospital about 4 to 5 hours.
Oh, wow.
It's
and
not
then
a whole lot of
recovery at
time.
home takes typically how long?
About a week or two. But
that's
for
not
most
bad.
people, a week. And even that week, you know, people are doing pretty well.
And once you have the lumpectomy, when then do they come back to see you? What then is protocol from that point?
Absolutely. So we typically get the results of surgery back about 3 business days later, and we do call people to let them know what that shows.
Yeah, you guys are really good about that.
So we try, we know, like you said, that waiting is horrible.
Right.
So we try to get to people as soon as possible. And then I see them back in the office about 2 weeks after surgery, make sure they're healing up okay, and discuss what other parts of their treatment do they need.
During that time, is there a lead person in this interdisciplinary model? Or does it shift from one person to the other?
Exactly. So I'm usually kind of the captain of the ship initially, but that does shift over time. So once the surgery is done and they move on to the other parts of their treatment, the captain of the ship does shift a little bit.
Oh my gosh, it sounds wonderful. Once again, we're here today to talk to Dr. Shelley Ringer. We're talking about breast health and breast surgeries. We really appreciate you taking time out of your day today. I know you've got surgery in a little bit to join us. Stay with us, there'll be more to come here on Healthy Living.
Thank you.